Imagine you have worked for 5 years on becoming an Olympian. You have set multiple personal bests, and by the time you were 19, you were one of the 10 fastest women of all time. You have overcome immense family tragedy before getting to stand upon the podium, placing first in the women's 100-meter dash. And you finally get to attend the Olympics. Now, imagine being told that you are disqualified and being stripped of your title and medal, all because you failed to conform to outdated drug regulations surrounding the use of marijuana. This is exactly what happened to American athlete Sha'Carri Richardson on June 28th. Richardson was unfairly disciplined for her use of marijuana prior to competing in the 2021 Olympic trials, and based on some very compelling information, this is why I feel that marijuana should be removed as a banned substance according to the Olympics, WADA, and USADA. According to the article Cannabis and Health and Performance of the Elite Athlete, surveys of athletes have suggested that cannabis use is rare but may vary by sex and by sport. A recent systematic survey by Brisola Santos highlights some important observations. Self-reported cannabis use among NCAA athletes was predominantly for social or recreational purposes, 61%. Only 0.6% stated that the use of cannabis was primarily for performance-enhancing purposes. There has also been very little evidence that marijuana is a performance-enhancing drug. However, it can be known to help with chronic pain and mental health. Looking at Richardson being stripped of her gold medal and given a 1-month suspension right before the Tokyo Olympics, all for failing to pass a drug test due to marijuana, I have looked over the Olympic rulebook, and as far as I understand, there is an exception to using certain drugs due to mental health or emotional coping reasons. This is called a therapeutic use exemption. Sha'Carri Richardson had found out just prior to competing in the 2021 Olympic trials that her mother had passed away. The marijuana was found in her system around June 19th of 2021. Marijuana can be found in your system for up to 90 days in hair, 30 days in urine, and 36 hours in blood, according to an article on medlineplus.gov. So depending on the intensity of the drug test, she could have had done the marijuana several days before competing in the Olympic trials. Marijuana is also a drug that is only labeled under banned during competition, not all times. According to Doping in Sports, A Never-Ending Story, the first official definition of doping dates from 1963, and it was used by the European Committee Council. Doping represents the use of substances of psychological mediators which are not normally present in the human body, introducing as an external aid to increase athletes' performance during a competition. In an article discussing sports medicine, the lack of data regarding whether or not marijuana is a performance-enhancing drug is limited. They have done several experiments testing the effect of marijuana and the placebo and saw very little difference. A direct quote from Cannabis and the Health and Performance of the Elite Athlete states, it should be noted that anxiolytic and sedative medications, as well as most pain medications, are not prohibited. A lack of performance-enhancing effect has been echoed in more recent reviews, including the most recent systematic review. And this conclusion suggests that the reason for considering cannabis as a banned substance is due to safety concerns and the fact that use of an illicit substance is contrary to the spirit of the sport. Also to be considered, in more recent years, recreational marijuana use is now legal in Canada, Australia, and parts of the United States. Richardson was currently, and at the time of the incident, in Oregon State, where recreational marijuana use is legal. In conclusion, understanding that marijuana, cannabis, or THC is an illegal substance according to the USADA, there are still gray areas surrounding what is prohibited. In the USADA list of prohibited substances, cannabis is listed under in competition, whereas there are other substances that are listed under both in and out of competition. Considering that THC cannabinoid markers can linger in your system for multiple days, up to a month, depending on the type of drug test given, it would be pretty difficult to determine when Richardson consumed the THC. Also listed on the USADA prohibited list under cannabinoids, there is a listed exemption for cannabidiol, CBD, which can help with muscle pain, feelings of well-being, anxiety, and insomnia. Considering that Sha'Carri Richardson just lost her mother, I would think that she would be put through a great deal of stress and emotional turmoil. And even if she did use THC, she could have been using it for soothing properties of the CBD. Section 4.4 of the official Olympic rules and regulations states the opportunity for a therapeutic use exemption. Considering the recent hardships of Sha'Carri Richardson has recently faced, I would consider her use of THC to be reconsidered on the grounds of a therapeutic use exemption. All in all, I do think that marijuana should be removed from the list of banned substances for the Olympics, WADA, and USADA. Thank you.